Hello, everyone. Welcome to today's webinar. Today, we'll be talking about driving successful patient engagement with Updox pharmacy technology. We have a great jam-packed agenda today with lots of good content, so I'll go ahead and jump right in. So here's an overview of how today's presentation will flow. So first, we'll start by exploring what patient engagement in pharmacy looks like today. What does it mean and what does it involve? And then we'll move into major challenges that independent pharmacies face when it comes to this topic. We'll also learn about the key ways to build an effective patient engagement strategy, and I'll show some real examples of how Updox pharmacy solutions can easily incorporate into any patient engagement strategy. We'll then close with a quick wrap up and answer any questions that you may have had during the session. And again, feel free to submit them into the Q&A box on the right panel. So what does patient engagement look like in independent pharmacy today? How do you engage with the patients in your pharmacy? Answers to this question can vary, and they rely on a lot of different factors, but healthcare professionals might have trouble delivering one distinct answer because definitions of what patient engagement is are different across the industry. The term itself is used a lot, but it's almost to the point where it's a buzzword that can be easy to tune out. So I want to explore what some of the industry organizations define as patient engagement. So the Agency for Healthcare Research and Quality defines patient engagement and experience as one, saying that patient experience encompasses the range of interactions that patients have with the healthcare system, anywhere from the health plans down to the healthcare providers, physician practices, pharmacies, and other healthcare facilities. So here the focus is really wide, and they encompass a lot of the moving parts of the industry for those who interact with patients on a daily basis. And they define it on a spectrum, highlighting those interactions and touch points that you all as healthcare providers have with your patients. On the other hand, HIMSS provides a very simple definition: providers and patients working together to improve health. So this really simply defines the who, the what, and the why, implying that it's a reciprocal relationship that must happen in order to improve those health outcomes for your patients. A third definition we looked at from Health Affairs defines patient engagement as a concept that combines a patient's knowledge, skills, ability, and willingness to manage his or her own healthcare interventions designed to increase activation and promote positive patient behavior. So this really highlights the responsibility and roles that patients have in managing and being involved in their own care. And this is really a trend that has continued to grow in the past couple of years and shows no signs of slowing down. And as information becomes more readily available, the barriers in healthcare continue to be knocked down. This will likely continue to be true. So the desire to have a comprehensive definition of patient engagement, in order to get to that, a Columbia University study from their School of Nursing and School of Public Health conducted a review of over 200 publications that covered patient engagement in an attempt to get one solid definition. And they came up with the desire and capability to actively choose to participate in a way that uniquely is to the individual in cooperation with a healthcare provider or institution for the purposes of maximizing outcomes or experiences of care. So there's a lot packed in that definition, and from these 200 publications, it really boils down to four common themes. So personalization, access to necessary resources, commitment to delivering great quality care, and building those positive patient-pharmacy relationships. It really would help to have that industry-wide definition that everyone understands, but until it happens, it's important to begin thinking about what patient engagement means for your pharmacy. What does patient engagement look like today in pharmacy? So there are some real challenges when it comes to patient engagement in pharmacy, but there are a few areas that really we can focus on. So this top row, there's a focus on mobile communication, and communication is really at the center of any patient engagement strategy. So mobile communication is a really hot trending topic right now. It seems that a lot of this is preferred method because a lot of people have mobile phones, internet capable devices nowadays. There's also the ability for online portals, and we're kind of shying away from some of those traditional communication methods such as phone calls and traditional email, since they have some of their own negative implications, especially when it comes to security risk and possible violation of HIPAA. The bottom here, we can see some of the newer medication counseling services or clinical offerings that have been popular in recent years in independent pharmacy. So some of the disease management programs, or even medication synchronization, medication therapy management or MTM, or even educational programs. Of course, this whole list is not exhaustive in any way, but this just begins to shape how we define patient engagement today. I'm hoping to get your wheels turning as to how you are engaging with your patients in your independent pharmacy. So we can't go on without acknowledging some of the major challenges that you all are facing when it comes to engaging your patients in pharmacy. So across the industry, what are you all facing every day that really presents major barriers to engaging truly with your patients? So one of the biggest is care collaboration. So care collaboration is one of the biggest issues facing the industry today, but especially when it comes to engaging with your patients. So there are numerous ways that gaps in care coordination, specifically with prescribers, can have major implications or in your patient health. Also have everyone's favorite topic, which is clinical and financial reimbursement. So this seems to be a huge industry topic right now. Everything from those clinical services that they continue to pile on your plate. How are you being reimbursed? The answer is probably not enough, and it really can vary by state, but it really is important to stay on top of new emerging models of practices within your independent states and within some of the organizations that you all may be members of. Time management is another huge challenge. So everything from managing your internal staff to making sure that the back end of your pharmacy operations are a well-oiled machine. Also involving your patients when they're outside of the pharmacy. And most of the time, they are outside of the pharmacy. So how do you make sure that you're managing your time with your patient outreach, as well as balancing that with some of the clinical duties and your traditional dispensing duties that take up 99% of your time. So now that we have a better idea about what patient engagement means in your pharmacy and some of the challenges to keep in mind, how should you as an independent go about building an effective patient engagement strategy? So I know that the big buzzword now is this whole transition to value-based care and the focus on adherence specifically in pharmacy. So to make it a little bit more digestible, we've broken it down to understand what this means for independence. So first, enabling simpler care access. This is pretty self-explanatory, but this is breaking down barriers and allowing patients to access and afford the care that they need and desire. And you as independent pharmacists have a unique position to really drive this point home, since you are often located in those geographically challenging areas, or you have that one-on-one interaction that patients might not be able to get anywhere else. Also, treating your patients with personalization, again, meaning that all of your patients walk through your doors and leave feeling that they had a unique interaction or experience with you and your staff. Something that is not very common when it comes to some of your competitors or some of the national chains. Also, generating new revenue. So this is ultimately a goal of most, if not all, independent pharmacies. And this is now coming in the form of clinical services. And although there are, of course, challenges with incorporating and realizing the full reimbursements, there is still revenue to be earned in some of these newer services. And finally, operating as a business. This is especially important for the back end of your pharmacy, as I mentioned earlier. So, continuing to control those operations and the financials, as the backbone of your business to ensure that your pharmacy continues to grow profit, attract patients, and continue to offer value to those patients. So trying to make it very simple, there are a few steps that any pharmacy can take in order to build a great patient engagement strategy. And we found some of the best action items that are simple yet effective, hoping that you can take at least part of this back with you and implement it into your own strategy. So first, it's important to create, update, or review your goals for your pharmacy. Putting a measure of success so that you can track and ensure that you're doing well. How can you really measure if you're doing well if you don't know kind of what your immediate goals are or future goals? So you could start by approaching the buckets or areas of growth where you would like to group similar goals. So maybe it is service for your pharmacy. Maybe you want to focus on goals related to the social or patient side, or maybe even profit and growth in general. These are just examples, but it's really whatever you can think of that you can attach a measurable return on to take your patient engagement strategy to another level. There's also exploring how patient engagement directly contributes to your clinical and financial goals. You could start with identifying how your pharmacy, of course, defines engagement, what that looks like for you and your staff, and write down those goals on a regular cadence. So maybe it's weekly, monthly, or yearly, and map each one of those goals together, thereby giving you that insight into how everything is intertwined, and maybe giving you insights to where you could improve. You could also review your referral strategy with local prescribers or some of the healthcare teams that you work with on a regular basis. So do you have a strong referral network with reliable communication? Or maybe you could use some TLC or some updating. Or, sometimes it takes one party to proactively reach out. And if that is your pharmacy reaching out to a local prescriber or physician, it'd be helpful to have a list of proven points about your pharmacy's success and have ready what you hope to achieve from the interaction and from the relationship. It's also important to research and verify the regulations for your state. So it seems that there are always new challenges happening frequently, and it's important to stay on top of that news so that you know if and how your pharmacy and patients will be affected. Pharmacists are extremely busy, of course, but one quick way to do this is to subscribe to publications that give you the quick rundown of major news happening within the industry. So this might be in CPA, or this might be Drug Topics, Small Doses, anything that summarizes those major newses, also giving you insight into what the industry has going on in general. Number 5 is looking at outlining a plan for you and your staff. So say you're going to focus on a specific clinical service, or maybe try a new method of patient engagement or a new piece of technology. Giving your staff a tangible asset to set those expectations and make sure everyone is on the same page is something that cannot be undervalued. You want to make sure that everyone is clear on what you expect of them and how to take that engagement tool and use it correctly. Number 6 is looking at technology, which is a huge driver for patient engagement. And it can be extremely effective when it's the right technology for your pharmacy. This can be difficult, but one place to find these is to search in the latest buyer's guides that are often published. So Computer Talk or organizations like NCPA often publish buyer's guides that give a comprehensive listing of technologies that are available, giving you the quick rundown of what they offer and why they're important. And lastly, in order to effectively engage with your patients, of course, it's crucial to know as much as you can about them. So many independents have those die-hard, loyal patients that they know personally just through interactions in or outside of the pharmacy. But surveying and maybe updating information about your patient base or looking at the demographics in your surrounding community may give you new ideas on how you can approach patient engagement or elevate it within your pharmacy now. So we've explored a lot of great ideas about how we can build a patient engagement strategy so far and what it looks like. But now I'd like to talk about some of the Updox patient engagement tools that can take your engagement strategy to another level. And I will walk through a couple of real-world examples that when paired with our solutions can save you tons of time, money, and resources. Our Updox pharmacy solution is called Pharmacy Connect, and it is a care coordination suite that arms you all as independent pharmacists with the tools that you need to communicate with patients and care team members seamlessly and with ease. And these exist to drive clinical services revenue, automate some of your administrative, manual, or paper-based processes, enhance care coordination between your pharmacy and other sites of care, and of course, boost patient engagement. And this is all done within one place, one collaboration hub, meaning that you and your staff can ditch your point solutions or your separate one-off technologies and bring it all together into one great option, which is Pharmacy Connect. So I want to start out with text messaging, since that is a huge method of patient outreach in the industry right now. And the solution is bidirectional, threaded conversations from your pharmacy, a 10-digit number within your area code, to the patient, back and forth. So any patient who has a cell phone number will be able to send and receive texts. One use case that I really like to give is sending happy birthday messages, or maybe even reminding certain patients to come in and pick up their prescriptions if they may need a one-off message. This is one of the newest types of technology, but it's really easy to implement. So here, as you can see on the screen there, on the monitor is what you would see as a pharmacy. So typing it in straight from your collaboration hub. And then Jane, our patient, would see it on the receiving end, saying that your prescription is now available to pick up. So again, engaging with your patients in a way that they want to be communicated with, in a way that they are constantly connected with. We also have a broadcast messaging option for patient outreach. And this really takes it a step further by allowing your pharmacy to create custom lists of patient demographics. And this can be by text message, phone, or a regular traditional email. And from this universal inbox that you see in the background of the monitor, you can send certain patients or groups of patients specific messages. So you may want to alert all of your patients 65 years and older about Medicare open enrollment period, asking them to come in and maybe just talk with the pharmacist about their current plan. Or maybe you want to reach out to all of your parents over the age of 32 about vaccinations for back to school. This Updox broadcast messaging will allow you to send these messages whatever way you want, to whomever you want, giving you that flexibility and the option to communicate with your patients in the ways that they prefer. Updox Pharmacy Connect also allows independent pharmacies to create custom online fillable forms that are accessible to your patients via computer or any mobile device that is able to access the internet. So this is a super easy way to collect patient information. As I mentioned earlier, maybe you want to survey your patients and just collect general information about them. Or maybe you just want a templated, consistent manner to convert some of your paper-based documents into a mobile version. These forms can be easily attached by a hyperlink to your pharmacy's current website for convenience as well. And as you can see here, you would also be able to fill it out as a patient on a mobile device. So this really saves you time and resources, specifically with manual paperwork within the pharmacy. So as an example, flu vaccinations, that's a huge one that's coming up here right now and in the fall. And how simple would it be if you could just shoot off a link or direct your patients to your website to say, hey, just fill out this form, I'll automatically receive it, and it'll save you time from having to fill this out manually when you're in the pharmacy. One of our biggest champions for this is Beth Bryan, and she's a fellow independent pharmacist out of Surgoinsville, Tennessee. And she really credits Pharmacy Connect specifically with the form solution for saving time, specifically with her staff. So 5 minutes of their time, saving almost an hour of staff time. You can imagine some of what you might be able to do with this in your pharmacy specifically. Patient messaging portal. This is also closely linked with our fillable forms, but this is another avenue that allows your pharmacy to exchange secure messages with the patient in HIPAA compliant manners. So this allows you to collect any patient information or exchange bidirectional messages with them securely. As you can see here, the computer monitor on the left, you'd be able to search for, tag, queue any line items that you would like. And you would also be able to message the patient directly from here, and any message that they send you would come back as a threaded line item. So you can use this any way that your organization desires, and it can be set up depending on how your workflows are. So the last feature in our patient engagement suite, kind of the newest addition, is secure text messaging. This offering is completely HIPAA-compliant text messaging that is all web-based, so no applications or hardware or anything to be bought or downloaded. That is accessible on any mobile device. So here you would see a screen that a patient would see when receiving a secure text message. So this is prompting them to authenticate their identity as the correct person in order to view the message that your pharmacy would send. So this is a representation of the flow, kind of what you would expect to see and what the patient would expect to see. You would, have an initial regular text message with a link that says, please review this secure text message that your pharmacist is sending you. And then they would log in with their birth date, and they'd be able to have a full threaded, naturally flowing conversation right on their mobile device, as you can see here on the bottom right under Jane. So again, this is really driving home some of those programs that specifically increase adherence, like medication therapy management or medication synchronizations. And it allows you to engage in real conversations and open another method of communication for your patients, especially if you don't have time to speak with them over the phone, something that is, sensitive information or something related to one of their medication. You'd be able to send and receive images or any other type of attachment or link as well. So again, just giving you a suite of solutions all in one hub that really tie patient engagement into one place that's easy to work out of for both the patient and your pharmacy. So bringing it all together, there are a lot of ways to approach patient engagement in independent pharmacy, but it really comes down to how you define it and how you strategize to get the most out of the interaction with your patients. So patient engagement may not have one standard definition, but it is definitely something to be mindful of since it's so dynamic and ever-changing and increasingly important, especially within independent pharmacy. You all are facing huge problems as community pharmacists with engaging patients, but you have the right foundation just in your nature by being independent to really maximize that engagement and implement real solutions to get through to your patients. And when you think about this topic in your pharmacy, it's important to come up with that strategy that is realistic and attainable, matching some of the goals that you already have, that you're looking to achieve. And this will look different for every independent since no two independents are alike. And of course, here at Updox, we are continually striving to enhance our product solutions, but we are offering Pharmacy Connect as a way to consolidate and kind of elevate your current patient outreach tools where you are today, and helping you in the transition to get to where you'd like to be, giving you the tools that will really make a difference in your pharmacy and for your patients.